plus having access to that health care. And that's worth fighting for, but we've got to get people down the path of fighting for it and not taking it away like what we've seen with this administration, Republican leadership.
And then Governor.
I was just gonna add one thing.
Senator.
Let's be clear that, all these years that the Republicans have held both houses of Congress in the last few years, that they have held both houses in Congress and presidency, they have failed to show us a replacement. All they wanna do is take away. They haven't shown us a plan. So show us the plan, if there is a plan, or show us a way to fix it and build it up, like we've all been saying. So pushing it off to 2020, there was no plan the last 10 years. Where's the plan?
Governor, the question for you, the last time we were down this road with Governor Sandoval, he mentioned if the state had to absorb trying to supplement Medicaid coverage, we're talking the hundreds of millions, if not further down the road into the $1 billion mark. The question I guess simply is, can the state absorb those costs in the next couple of years if there's a change?
Those are enormous costs that you're talking about absorbing, but I can tell you nothing is more important. This is not a partisan issue. This is a people issue. I mean, I've got as many friends on the Republican side that have pre-existing conditions and lifetime limits and that are facing these same issues. This affects the quality of life and the life, as with his wife, people into the future. So the state and under my administration, we will do absolutely everything we can to assure that people continue to be covered with healthcare coverage.
Last question.
Anyone else?
Well, I just want to thank for being here and for leading this conversation. I am the state director for Mi Familia Vota. I also have a pre-existing condition thanks to the Affordable Care Act. We have access to preventative medicine, and thanks to that, I was able to be diagnosed with very early stage of cancer, and I was able to have surgery within a week. Now I depend on having checkups every 6 months in order to continue to be cancer-free. And with the repeal of the ACA, it means that thousands of Nevadans like myself won't have access to have their checkup every 6 months. Also, speaking from our Latino communities that had access, millions of Latinos had access to healthcare thanks to the ACA. And with the repeal, millions of Latinos will lose access to ACA. Now we see other states, speaking of states that duplicated, states that have policies that help our immigrant community, like California, that allows DACA recipients to buy their own health insurance in or out of the health insurance through their employer. Should we, continue to advocate for these policies that also favor all of us, but also are thinking about our immigrant communities?
Well, I can just from the state point of view, and I'd be happy for the senators to answer it better. We've opened the office. We're proposing of New Americans, which is going to go a long way, we feel, toward addressing communities. The Asian community, the Latino community in particular, have been underrepresented and underfunded, if you want to call it that. We are committed to making sure that everyone, regardless of your ethnicity, your gender, your race, has access to quality health care. And you're right, prevention on the front end, more frequent checkups can save an awful lot of money. This is a good business decision. You'd rather treat it on the front end when it's not so expensive as opposed to waiting to get to the back end where the cost is exponentially increased. So we're committed to doing what we can.
Yeah, and I think it's the same at the federal level when we're talking about healthcare. It's this idea that we're bringing affordable and accessible healthcare to everyone, no matter where you're from, where you live, what community you come from. That's what it's about. And the fight is on at the federal level to ensure that happens. There are many of us that are going to be in the trenches, making sure we are doing everything we can to prevent this administration from repealing the Affordable Care Act, from taking us back. But you talked about an important thing, and let me just say this because Jacky brought this up. This idea of preventative care and coverage for essential benefits, that's part of the Affordable Care Act. Think about this. If you have the peace of mind and the comfort to know that you can go and get preventative care that's going to identify ahead of time, God forbid, any acute symptom or disease that you have, and you can get care for that, you're going to do it. There are too many people that I have met across this country, including in my own family, that can't get the health care coverage they need, so they do without, and they're suffering in pain. in silence. And so we've gotta stop that. This is about bringing back this idea of peace of comfort and dignity to individuals so that they know that they can have access to healthcare in this country. Anybody, I don't care where you're from.
No, I think you've said it, the 10 essential health benefits. I think the senator said it, the 10 essential health benefits bring dignity and common sense to the healthcare conversation, and we need to protect those at all costs, and that's what we're all here in the fight to do. That's why you're here today as well. So I thank you for being here and for all the work that you do. So appreciate it.
If I could ask if we could just get one more round of applause for these brave folks.